Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 10 of the Ask Dr. Angela podcast. Let's jump right into today's question. Today's question is coming to us from Cherish, Toms River, New Jersey. Cherish, what do you have for us today?
My name is Cherish from Toms River, New Jersey. What is the age you should start getting mammograms when you have family history of breast cancer?
That's a really excellent question, Cherish. With regards to when you should start screening for mammograms, the general recommendation is at the age of 40. However, if you do have a family history of breast cancer, specifically in a first-degree relative, and when I'm talking about first-degree relatives, I'm specifically speaking about mom, dad, siblings that were diagnosed with breast cancer, we typically recommend that you begin screening 10 years prior to the age of the affected relative's age of diagnosis. For example, if your mom was diagnosed with breast cancer at the age of 40, the general rule of thumb would be for you to begin your breast cancer screening at the age of 30, and that's typically done with a mammogram. I see quite a few patients that are getting these baseline mammograms at the age of 35, and that really is not the recommendation per the American College of OBGYN guidelines. The other thing that I typically recommend to my patients, which is also based on an ACOG guideline, is breast awareness. Just generally knowing what your breasts look and feel like. I typically recommend that my patients do their self-breast exams a week after their menstrual period. That way your breasts aren't painful, sore, lumpy, bumpy. These are just some of the changes that can be experienced around the time of your menstrual period. Cherish, I certainly hope that I have answered your question. Thank you so much for taking time out of your busy day to submit a question to the Ask Dr. Angela podcast. For those of you who would like to have a question featured on the Ask Dr. Angela podcast, please go to www.askdrangela, that's AskDrAngela.com, and leave your questions. When you do leave your questions, please remember to not only leave your name, but leave your location. Cherish, someone will be reaching out to you very shortly to get your information so that we can send you one of our bomb-ass t-shirts. In closing, today's thought of the day is as follows. Always concentrate on how far you've come rather than how far you have left to go. Until next time, look better, feel better, be better. I'll see you for episode 11.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.